mental disorders are real, and your mental health should be your priority as your physical health or your medical health. We need is that when we have anxiety disorder, we can practice mindfulness and meditation. Having a mental disorder can move you from hero to zero. You can have billions, and mental disorder can drain you, becoming poor. You can meditate on the word of God.
Okay.
Yes, and this can distract you from the worriness and the fear, the consistent fear that is coming, the intrusive thoughts. Yes, and so people who are having problem with intimacy, one is open communication. You can communicate with your partner, your husband, about some of the things.
All right, you're welcome back to Sex in the Temple. Like I always say, click in that subscription button because you do us a favor when you do so. We're going to continue today with anxiety disorders. When we stopped on our previous episode, we talked about how sometimes in our anxious mode, the hormones are distorted and it even delays or you skip menstruation. So we're going to continue with that and also help with information that will guide you to seek professional help in this. There's a Sex in the Temple, and with me here again is the ever handsome, cute, dark-skinned African chocolate king, Joshua. You're welcome.
Thank you.
All right, so we are saying that sometimes the follicle-stimulating hormone or the luteinizing hormone, because of the pituitary gland that releases some hormones, is distorted, it delays period or menses. Yeah, let's take it from there, and we'll help listeners to understand that this can happen.
Yes, it can happen, but it's not common,
Okay.
but it happens.
All right.
So if you want to understand that it's maybe pregnancy or it's not pregnancy, you can visit the hospital when you have delay or when your menstrual period skips. You can visit the hospital to confirm if it's pregnancy, and you find out it's not pregnancy, you can seek for medical treatment. It could be that something is wrong somewhere, so you can seek for medical treatment as well.
Okay, so the advice is that let's rule out pregnancy.
Yes.
Maybe some people don't even know that they're in the state of this depression or anxiety,
Yes.
and it's excessive. So your advice is that, okay, rule out pregnancy and then seek further professional advice or treatment. All right, that's good. I think I can take a sip to that. Just take a sip to that. That's good. We love it. Seek advice. Here we give you guidelines and information. Thank you for that. So you talked about, as you were speaking, what I was thinking is that imagine for couples who are married for a long time, they've been looking for a child, and all of a sudden, the woman skips her menses, and sometimes they even start craving. They don't go for medical checkup. They will have this false impression that they are pregnant, but they might not be. So the advice is, even with that, seek professional help. That's good, that's good. So you talked about also another anxiety, that they are anxious and they don't want to have children. Help us with that. Give us a better understanding of that one.
Yes. So I mentioned that earlier, and it's a specific phobia,
Okay.
which is a type of anxiety disorder,
Okay.
where people fear to have children.
Okay.
It could be past experience, and it could be fear of commitment as well. And also the responsibilities that will come in taking care of children and combining them with work. Yes, because the person is thinking of the work overload she has been dealing with, and coming to combine it with taking care of children, and also going through the pregnancy period, having all the hormonal imbalances, which is going to affect the person, the dark pigmentation. Some people, they love their skin to the extent that they don't want to get pregnant so that the skin will change. They always want to look beautiful. They think that that could be a way of stressing them. and it could affect how they want to live their life. So all these are risk factors of the fear of sex.
Okay, so once you're talking, what came to my mind is I know a group of ladies who said my breast, the way I look at my breast, it is full. I don't want it flabby, so I prefer not to have a child who will make my breast, after they suck my breast, flabby, and I lose, all of this cleavage and all of these nice things. And some will say, I don't want stretch marks, imagine me being pregnant, my pregnancy is so big, and then after giving birth, I have this stretch marks, I don't want that. So all of that can be a concern that has to be discussed with your partner, if this is your fear, or maybe with a professional person to deal with that, is it?
Yes, you can discuss that with your partner, and if your partner accepts to go for professional treatment, you can also go for professional treatment. All that you said could be a factor of fear of sex. So in mental health, we say risk factors that cause mental disorders are multifactorial, meaning we have various factors that can result in that. Yes, so your factors will not be the same as my factors.
Yes.
Yes, what will cause mental disorder with you will not be the same as mine. So it's multifactorial. And the fact that you were able to have this disorder because of these factors doesn't mean I should also have this disorder with the same factors. Yes.
Okay, so there are a variety of factors
Yes,
that come
that can.
into play before. It's good. I like what we are talking about, because these are things that people, when they say I have a mental breakdown, they label you in our society. They have a tag, they stigmatize you, and they just think that when you have this breakdown, you're gone crazy, you're cuckoo. But what you're saying here is that when this concern persists and they become excessive, they will affect your daily living. They
Yes.
affect the choices and decisions you're making.
Yes.
And we should seek help, especially for couples who find themselves in this situation. Imagine in Africa here, when you get married, the next year or so, what your in-laws and the friends and the church members, oh yeah, the church members, yeah, and the neighbors and the aunties and the uncles, they'll start asking you, so, when are you giving birth? What's happening? And meanwhile, you are afraid of having a child, because when you have the child, what happened? They will come and disturb your lifestyle, your image, your job, the sleepless night, and you are not ready for that. You're not prepared for that. So it's important that we educate people about that, isn't it?
Yes.
Yeah, yeah. So it's good. It's good. Yeah. So as we look at all of this, what are some of the things that you want to help us with to talk about? I mean, what we've discussed so far. Maybe recommendations, maybe advice, and how we deal with these issues.
Yeah, so first of all, I want to let everybody knows that mental disorders are real, and your mental health should be your priority as your physical health or your medical health. We need to take it very serious. Having a mental disorder can move you from hero to zero. You can have billions, and mental disorder can drain you, becoming poor. Yes, so we need to take serious of mental disorders, and we need to learn various mental disorders and also educate people about that. Once you hear about some of the things that would be a risk factor to certain disorders, some of the things you can do to help you, you also educate people or people within your surrounding, so that they will not engage themselves in having a mental disorder, especially anxiety disorder. And what I can say from our homes is that when we have anxiety disorder, we can practice mindfulness and meditation.
Okay, explain that one.
Yes, so mindfulness and meditation is about you can meditate on the word of God.
Okay.
Yes, and this can distract you from the worriness and the fear. the consistent fear that is coming, the intrusive thoughts. Yes, and we can practice exercise.
Okay.
So doing exercise can also distract you from the fear and all that. And you can also see for therapies like the cognitive behavioral therapy, where we try to restructure your negative thoughts and also help you modify your behavior. And you can, if it's about fear of sex, marriage and children, you can also seek for sex therapists and they'll also take you through that. So these are some of the things we can do from home and some of the things we can also do by seeking help from professionals.
All right, thank you. I'm going to take them one after the other. You said that if we have negative, intrusive thought, you're recommending, because we belong to a certain religious group, for Christians, you want to take Bible study seriously and look for those Bible promises that make you feel comfortable and reassurance. Some people, they just need scriptures to affirm that they are fearfully and wonderfully made, that God loves them, and that they're unique, because some people have negative perceptions about their body image and about their outlook in life. So you're saying that, meditate on that. It will help you with the intrusive thought.
Yes.
And you're also saying that exercise plays a role in helping. So I love exercise a lot, so I hinge on that. When I'm stressed out, okay, sometimes I have a lot of things to deal with and my brain cannot take it. What I do, I just take off my sneakers and then just take off my jogging pants and off I go. By the time I come, I feel so relieved, so relaxed. So I can attest to that exercise helps a lot. Maybe you can't jog, but you can walk, right? Long distance walk. Okay, and you can do cycling, swimming. That also can help because it helps the body and it helps your mind, because you focus on certain things instead of the intrusive thought. And you talked about what else? That cognitive therapy. And in cognitive therapy, what do you help people with, basically?
So cognitive behavioral therapy.
Yes.
So it helps to restructure your negative thinking. So people with negative thinking or negative thoughts about certain things, we help to restructure those negative thinking. And the behavioral therapy is about trying to modify the behavior. Once you have the intrusive thought, you constantly do what comes into your mind. So we try to restructure. So we take you to series of sessions so that it will help you restructure the negative thinking, do away with the negative thinking, and then we try to guide you build or modify your behavior. That's basic principle about cognitive behavioral therapy.
So cognitive behavior therapy, I'm thinking about something, doesn't mean I have to act on it. It doesn't mean I have to act on it. It doesn't mean that I have to allow it to take over my life.
Yes.
So what you, the mental health professionals do is to guide me to see these intrusive thoughts can come, but there is a way that you can manage the way you react to this thought and how it affects your activities.
Yes.
And the behavior also doesn't mean that I have closed the door. Okay, I'm finding myself guilty on that one now. I've closed the door, I stepped out, and I'm in the middle of doing something. And then I realized, did I close the door? And everything else that is happening there, someone talking to me, I'm not paying attention. I am thinking about that door that I didn't close. So you're saying to me, in the sessions that you're having, if I have that challenge, you will try to modify my behavior to say, okay, let's say it's open. What's the worst thing can happen? Or you want me to understand that it doesn't necessarily mean that it is open. It's just my thoughts playing some things with my mind.
Yes.
So you help me daily. That's a long-term process because it's not going to change easily.
Yes, it's a long time.
So the person has to be committed to doing that. And for those who have issues with sexual intimacy, who are struggling because of unresolved childhood traumas, what are some of the recommendations that you bring for people like that?
So people who are having problem with intimacy, one is open communication. You can communicate with your partner, your husband, about some of the things or the reasons why you are not able to engage in effective communication. You discuss to your partner about the stress. Is it coming from the workplace? Is it coming from finances? Did you lose any loved one? So you discuss with your partner that this is the reason and this happened to me and this is why I'm behaving in this manner. So when you're going to stress and you communicate with your partner about what is causing the stress, your partner will understand you and understand that this is what you're going through. So your partner is going to take time and also help you to deal with it.
So you were saying about this fear, and you talked about the one that you're afraid of intimacy. I want us to delve deep into that.
So
yeah.
with the fear of having children, the fear of sex, and the fear of marriage.
Okay.
Some deals with past experiences.
Okay.
So when you look at the fear of sex,
yeah.
it could be the person was raped or abused when growing up.
Okay.
And this can also affect the person not to even engage in sex. And with the fear of marriage, when he was growing up, the person witnessed maybe the father abusing the mother. This could also be a factor. Yes, and this can affect intimacy, the closeness, where you can open up to your partner, where you can share that emotional connection. It can affect that.
Okay. All right. So I want us to go deep into this sex, the fear of sex. Like, so you said if somebody was raped as a child, they become afraid, or if they engage, does it bring back the memory of what happened, or they don't engage at all?
Yes, it's two things. It's
Okay.
either the person will avoid sex or the person will engage, but it will bring out the memories. So before the person can engage in sex, that means psychologically the person is prepared and is relieved from what happened some years ago, and the person wants to try sex. But when she is not careful, it can bring back the memories. And that is also another form of post-traumatic stress disorder. Yes, it will reflect the memories of the traumatic event the person faced.
So that means those issues should be resolved.
Yes.
But we live in a society where most victims don't come out. And as a child, if they abuse you, you can't say much about it. And now you don't want to stay, you're married, because we believe in marriage, sex within the confines of marriage. And now you're married to your couple, to your husband, sorry. But it can be a man, it can be a woman, but you are not comfortable talking about your sexual experience. And now you're engaging, but your body is not into it. What are some of the things that play around it when people don't have when people have unresolved issues with sexual intimacy?
So I think first of all, if we want to resolve these issues, we need to educate the public about situations like this so that they will it will empower them to come out, seek for treatment, visit psychologists, sex therapists for treatment and ways they can guide them to resolve these issues. Certain issues like this is not easy to resolve. Sometimes you need to seek professional assistance. You need to visit a sex therapy who can delve you into that,
Okay.
or a psychologist to delve you into that and teach you how you can resolve certain situations like that.
Okay.
So couples who are having experiences like this should seek treatment or professional assistance from sex therapists and other psychologists to help them.
Okay, so that means they should have a conversation before they get married about these issues.
Yes.
But if they don't, that means they will face challenges in their marriage. And sometimes, does it lead to separation, divorce, or does it lead to...
It can.
Okay.
It can. It can. Because every man wants to have sexual activity with the woman he's married to.
Okay.
Yes, so when it does not happen like that, it can call for separation and divorce. So the man will rather go in for someone who will give him what he wants.
Okay.
Yes, so it's very necessary for women to voice out. They should get the courage. We should empower them. We should not stigmatize them that this lady was raped. And the sex therapist and the psychologist should also assure them of confidentiality.
Yes.
And the people around them. Now, if I'm having such a problem and you're my sister and I tell you, and you use that against me, do you think I will get the courage to go for treatment? No. Yes, so we need to encourage them. The one she trusted came to you and tell you about my situation. You have to encourage that person. You have to first assure the person of confidentiality so that the person will develop trust so that she can go for professional treatment. And when they do that, it will help them.
Yeah, I'm glad you talked about confidentiality. So let's say in my community that I live, and we have this auntie who works in that center, and the center service are not youth friendly. And the auntie knows my mom, and maybe I'm afraid to disclose that, and I go, and the auntie sees me. I didn't go to her, but went to the clinic, and because of what they do in that clinic, she assumes. And all of a sudden, they'll say, I saw your daughter at the clinic today. Is she pregnant? Something happened. So what you said is so important that we should have confidentiality issues. We have to take note of that. And also to have youth-friendly services that will encourage them and create a space where they are comfortable to talk and resolve them. That's so good. So for couples who are facing this challenge, where one of the partner is not readily willing to engage in sexual activity, and the husband or the wife can communicate to them, what do you think? How do you think they should communicate before they go seek for professional help? Because sometimes you don't know what to say, and whatever you recommend might not be right.
Yes, you are married. Both of you are married. And before you married, you were able to talk about certain things and you came into agreement and married.
Yes.
So that kind of union should give you, these people, the space to communicate with each other.
Okay.
So once you are married, you went through a lot of processes before you accepted him as your husband, and the husband accepted her as the wife.
Okay.
So you should always have open communication with your husband and wife. Talk about certain things that is unpleasant. Talk about certain things that you don't like. So when you want to get money to cook, you go to your husband, right?
Yeah.
So you should have the courage to go to your husband and talk about what is the challenges you are facing so that both of you can resolve it.
Yeah, that's so. Thank you so much. The reason why I'm emphasizing is the fact that on the side of the world that we live, when women talk about too much of sex and intimacy and try to speak up their mind, people might think, oh, this one, she's spoiled already. And because of that, even to initiate sex, from a woman's point of view, it has to be the man that initiated. The woman receives it. And when they receive, sometimes it's not what they want, but they go with the flow, not even disclosing what I desire or what I really, engage in. So that's why I'm emphasizing. And it's good that you said that we talk about it. So let's say if I have that issue, I should be able to talk about it.
Yes, you should. You should be able to talk about it.
Okay.
Most people, what facilitates intimate sex is open communication. So before you engage in that, you should talk to your wife about certain things like that.
Okay.
Yet it facilitates intimacy.
Okay.
Yes, very necessary.
Yeah. So how does these disorders affect sex now when it comes to engaging? So we talked about being afraid. This is the person who is afraid. But you talk about a disorder also that they don't want to engage in sex. So if you are anxious or you are stressed out, how does that play in to sexual intimacy?
Very good. So before I will link it to some of the risk factors
Okay, go ahead.
of anxiety disorder.
Okay.
Yes. So one is the hormonal imbalances that occur. So in certain people, there is always increase in cortisol. Cortisol is a stress releasing hormone.
Okay.
Yes, and when there is excessive cortisol, it dysregulates the hypothalamic pituitary gland axis.
Okay.
So this is a complex system that helps in managing stress. So when this HPA axis is dysregulated, that is when it becomes beyond your limit and you find it difficult to manage.